Hi everybody, it's Jennifer Jackson with Heartland Counseling. I hope you're having a good night. We got some questions this week from viewers asking us what is the difference between a mental health evaluation, a psychiatric evaluation, and a psychological evaluation. So I'm going to explain the differences. In Nebraska, we do what's called an IDI, an initial diagnostic interview. This is the mental health evaluation. What we determine, and this is all master's level therapist, you have to have the highest license, which is a LIMHP, licensed independent mental health practitioner. So they meet with you and your family. It takes about an hour the first time. And we are going to determine what services you need. Do you need individual? Do you need group? Do you need couples therapy? And maybe what kind of therapy do you need? Do you need to see somebody that specializes maybe in adoption or dialectic behavioral therapy or trauma-focused therapy? Whatever you need, our therapists are going to help determine those things. We also are going to determine if you need a psychological eval or do you need a psychiatric eval. So you can't just come in and go straight to the psychiatrist. That's not how it works. They won't see you. You have to see a therapist first. So next, then you see, for a psychiatric evaluation, you're going to meet with a psychiatrist. A psychiatrist is a medical doctor who will then help determine what kind of medications you need to take for your mental health. And that is done all through telehealth. We work very closely and partner with Richard Young Outpatient Clinic out of Kearney, Nebraska. We've been doing this for 7 years. It's been very successful. And you will meet with your doctor ongoing to maintain your mental health and your medication. So the next thing that we may recommend is psychological evaluation. A psychological evaluation is also done by a doctor, but this doctor is called a psychologist. A psychologist does different types of testing, or they're called batteries of tests. And they may help us determine your IQ, if you need, maybe you need to be determined whether or not you have disability, or if we need to just more input on maybe what your diagnosis is. There's all kinds of things that can be done for this. It can help determine even if you have ADHD, if you have a personality disorder, but this has to be done by another type of doctor, which is a psychologist. And at Heartland, we have Dr. Annie Stakowitz. So I wanted to explain the three, because lots of times people say, oh, I need a psychological eval done. Well, really you don't. You need a mental health eval done first, and then possibly get a psychological eval, and then a psychiatric eval, or vice versa. So, but it always starts out with Heartland as an IDI, an initial diagnostic interview, or a mental health evaluation. So that's how you determine what services you need, and also a diagnosis to see what services you're also eligible for. So I hope that clears it up. And remember, May is Mental Health Awareness Month, and wear your green. I have my green pants on today to help with that. So I'm challenging everybody to wear green as much as you can this month, and take care of you.